Good afternoon, everyone, and thank you all so much for coming. Welcome back to the Mayor's Gallery here at Metro Hall. My team and I are working every day to make Louisville a safer, stronger, and healthier city. And we do that by facing our most significant challenges head on, collaborating with partners, and creating solutions. That's what we're here to talk about today. We're focusing on one of our biggest issues that we're dealing with as a community, and that's homelessness. It's an issue that cities all across America are struggling with. No city appears to have solved this challenge completely. Yet here in Louisville, we have a plan. And part of that plan is that we're developing a community care campus. This campus will provide transitional shelter, connection to community services, and much more, with a focus on families who are experiencing homelessness. This campus is just south of our downtown medical campus and aligns with other available services in the nearby vicinity. From the beginning, we established the priorities for this project by listening to the community and to the people who are most familiar with the challenges facing people who are homeless in our city. One of our goals with the Community Care Campus is to reduce the burden on existing homeless service agencies. And that's essential because many of them are overwhelmed and experiencing rising costs. Right now, on any given night, we have approximately 15 families on a wait list to get into a shelter, and that's unacceptable. Our city has established a path for veterans to get housing, and now we want to do a better job for our families and children, so they don't have to sleep in cars or under bridges or on sidewalks. This is an opportunity for us to close the gap that exists today for families who are trying to get off of the street. And this is critically needed. The Community Care Campus, along with our efforts to build more permanent affordable housing all across our city, will be transformational for Louisville. I first announced the Community Care Campus back in January, less than 4 weeks after I became mayor. In April, I presented my budget, which including funding to acquire more land and advance the planning process. In June, the Metro Council approved that funding and the overall budget with unanimous vote. And in July, we requested proposals through the Metro RFP process to look for a partner in the private sector who would operate the campus on a daily basis. Before I go any further, let me take 1 minute to acknowledge a few of the members of our Metro team who have worked so hard on this project over the course of this year. Julie Henson, Marilyn Harris, Deputy Mayor Nicole George, and so many others have worked tirelessly to make this campus a reality. Thank you all very much. Thanks also to our partners. We've had several strong community partners step up to inform our work on the Community Care Campus, to provide support and other services. This project, this innovative, transformational project, requires a partner who understands what we're trying to do and who has the experience, capabilities, and adaptability to make our vision for this campus a reality. Today, I'm proud to announce that Louisville Metro government has selected Volunteers of America as our operating partner for the Community Care Campus. VOA really impressed our team with their proposal. They showed us that they understand our community priorities and can turn those into an effective operation. VOA will be instrumental in putting together the emergency shelter for families at the Community Care Campus. VOA will also be collaborating with us to provide permanent supporting housing for families on the Community Care Campus. And VOA, under the leadership of Jennifer Hancock, who is here with us today, is already a significant partner with Metro government who has proven that they do important and impactful work in our city. For example, our city budget provides funding for VOA's support for other parts of our homeless population. And VOA has nearly a 40-year history of providing emergency shelter for homeless families at Unity House. They know this work. That's why VOA will be managing services and shelter operations at the Community Care Campus. VOA and Metro government are also in current conversations with other healthcare and social service providers regarding other aspects of this project for other space on the Community Care Campus so that we can provide additional services and shelter for those in need. The needs of this population are tremendous and they're complex. And it's going to take a variety of partners, a variety of resources, and a variety of approaches to make progress, the progress that we all need across our city. And while there's more work to do and we have more decisions to make, I'm really excited about the partnership with VOA and what we can do together. So without further ado, let me introduce a great leader, someone who I and all of Metro government are proud to expand our partnership with, and that's the President and CEO of Volunteers of America, Jennifer Hancock. Jennifer?
Thank you, Mayor. Thank you so much. Well, good afternoon, everyone. Volunteers of America is absolutely honored to partner with the City of Louisville and this incredible team led by our mayor to take on management of the new Community Care Campus. There is no question that the issue of homelessness is one of the most urgent and critical challenges facing our city, particularly over these past few years. Those of us who work downtown or live downtown see every single day how homelessness has increased in both volume as well as the intensity of needs. And I can tell you that my colleagues and I are ready to address this challenge head on. Volunteers of America has served our community for more than 125 years. From our addiction recovery services, programs for veterans, our community health worker services, and restorative justice, we're on the front lines serving some of the most vulnerable throughout Louisville. And in our VOA Home Division, we provide a full range of services from eviction prevention, emergency shelter services, rapid rehousing, transitional housing, and permanent supportive housing. As the mayor mentioned, next year, our Unity House program for unhoused children and families will celebrate 40 years of providing housing services to the city of Louisville. Every year, we help nearly 100 families and more than 200 children secure housing and get back on their feet. We'll take this experience and this expertise to the C3 campus and replicate our successful Unity House program and develop affordable housing. I want to be clear about an important tenet of how VOA approaches our work. We will be collaborative. We know we cannot do this work alone, and we want to create meaningful partnerships with other service providers, healthcare partners, law enforcement, the business community, and the philanthropic community. We welcome partnerships with anyone or any entity who's passionate about making an impact, not only with the population needing these services the most, but also wants to create a safer downtown that is bustling with positive energy and creating a positive economic dynamic for our entire city and for the Commonwealth. We are incredibly fortunate in this city to be blessed with so many philanthropists, top-notch healthcare providers, service providers, and this will be a campus where we can create economies of scale and a holistic, full continuum of care. As I hope you can see, I am honored for VOA to be selected to partner with the mayor and his team on this incredible opportunity for our city, and we are prepared to do the hardest work to bring this to fruition. To show our commitment to this endeavor, VOA has started exploring the possibility of relocating our headquarters from our current 4th Street location to this campus. Over the next few months, we'll finalize a master plan for the campus, which will contemplate this potential move for more than 50 of our administrative employees who work out of our headquarters, as well as the new family shelter that can accommodate up to 34 families and will be modeled after our Unity House. We'll have 80 units of low-income housing that will be created to provide even more affordable options to individuals who need housing. As we begin the planning process, and at the start of next year, we would happily welcome feedback from local leaders, businesses, and the community at large to ensure this resource is as effective as possible. This is an incredible opportunity for the city of Louisville. We believe in this city, we believe in its people, and we believe in the vision that the mayor is casting for all of us. And I believe we're about to do something that is truly remarkable together. BOA's commitment to this project is to be accountable for getting results for our community, and I'm confident we will do so with the support of the Louisville Metro team and the support of the greater Louisville community. Thank you so much.
Thank you so much, Jennifer, and we are so excited to continuing partnering together. Next, I'd like to introduce another community leader who has provided great insight and advice to my colleagues and I at Louisville Metro government for a long time now, and someone who is also working very hard every day to provide support to individuals in need all across our community. She's on the front lines of this situation that we're dealing with in our city every day and every night. I'd like to next welcome the Executive Director of the Coalition for the Homeless, Natalie Harris. Natalie?
Thank you. Yes, thank you, Mayor Greenberg, for the opportunity to celebrate this great news. I'm Natalie Harris with the Coalition for the Homeless, and I'm here today representing over 40 different agencies in our community who all work to address homelessness in Louisville. I do not need to tell anyone who is here today that Louisville has seen an increase in the number of people that have lost their housing in the city over the last 5 years now. This is due to a lack of new housing development and the increase in cost of housing. The increase in visibility of the homelessness led us to create our new comprehensive plan, which is called A New Path Home. And this plan actually aligns perfectly with the mayor's new plan, My Louisville Home. Both of these focus on the true answer to homelessness, which is permanent, affordable housing for everyone. But until we can create the level of housing that we have talked about in both of our plans, we also have included 3 other priorities: eviction prevention, medical respite, and emergency shelter to ensure that every single person has a safe place to come indoors. In January of 23, when we conducted the last annual point-in-time count, there were 950 people who were staying in either emergency or transitional housing here in the city. At the same time, we were able to count 581 people who were forced to sleep outdoors because there were no other options. And that was just in a one-day count of the people that we were able to find. The group that is hardest to count, and the one that we talk about the least, are families with children. Every Friday, I have the worst news of my week, which is when I get the report of the number of families who are homeless in our city who have called for help, and we have had to put them on a wait list because there is not enough shelter for every family that is in need. This past Friday, as we entered the weekend where temperatures were to dip below 30s, the 13 families were staying in their vehicles or in tents. 7 were in temporary places with other families or friends. 6 were in short-term stays at hotels that are mostly paid for by local agencies, just trying to keep those people safe until they can get into shelter. And so I am extremely excited about the future of the community care campus, which may be able to address many of the needs that are in our plan, but very hopeful especially that it will target families and that Volunteers of America will be leading that effort, one that they have excelled in for decades. I want to thank the city for this important investment toward our city's needs and for Volunteers of America for stepping up. But I also want to end with a challenge. Both the city and VOA have stepped up, but they cannot do it alone. And so what I'm asking is for our community as a whole, every citizen, to think of what is the one thing you can do, what is one way that you can contribute to make sure that not just this program, but all of the emergency services in our community can be successful and everyone will have a safe place to come in. Thank you.
Thank you so much, Natalie, for the work that you and all of your colleagues at the Coalition for the Homeless do every day in our city. And finally, I'd like to introduce someone who I met earlier this year, an individual who is working every day on the streets across our city, helping individuals who are homeless or who are at the greatest risk of becoming homeless get access to services, access to employment, and other support that they need to have an improved path in life. Ladies and gentlemen, let me introduce my friend, Farrah Burleson, who works with Goodwill Industries here in Kentucky. Farrah?
Thank you, Mayor. I appreciate it. Hello, Farrah Burleson. I'm an outreach specialist for the Another Way program at Goodwill. And I started off 2.5 years ago and I was homeless. And so I can bring a different perspective to what's going on here and make it make sense. When you're homeless, you really don't have any type of goal or vision about what's going to happen in your future because all you're thinking of is how I'm going to eat and where am I going to sleep. So when there's people like the VOA and the Homeless Coalition and the mayor's office that come together like this and present us with an opportunity to go out and help people, man, that's exciting. As my outreach position evolves from homelessness, I've traveled with Goodwill up through a corporate ladder that I knew nothing of. But Goodwill helped me along the way to put me in position today where I could come and bring a different perspective. As I was working today, as at my outreach job, I sat down with a gentleman who was older, and him and his wife have 5 small children, and they're staying in an abandoned car. And do you know how heartbreaking it was for me to have to call the emergency bed line, and the only thing they could get for a family was the basement floor at a shelter? That broke my heart. It absolutely broke my heart. And not only did it break my heart, it caused more fire to start in me to want to see things like this come to fruition, that I want to see my community rise up to reach out their hand and help the other person. These are our peers. Yes, I understand there's a stigma that goes with homelessness. And yes, it's scary. And yes, it's a road that not everybody gets to travel. But boy, let me tell you, it is rewarding. It is absolutely rewarding. It is rewarding when you see people, strong, powerful women and men coming together to say, look, we see this need and we're going to address this. That makes me feel really supported as an outreach specialist. That makes me feel very supported as a young woman growing up in this community, in the city of Louisville. I think that it's very important that we all understand how powerful this could really be. When I sit at my job and I can say, hey, listen, there's a community care campus that I can put you in touch with the right people. And you and your 5 children and your wife don't have to sleep in that abandoned car. There's nothing more powerful than having that resource in my pocket to say to this man that's struggling and broken, man, I got you. I got you. Just hold on for me. Let me show you the way out. And it just makes my heart very happy that you guys invited me here today to share my perspective. And I thank you very, very much. And I'm excited about what our city's about to do with this project. It's a beautiful thing, and I'm so excited to be a part of it. Thank you, Mary Greenberg.
Thank you so much. Thank you so much. We are so fortunate in our city to have folks like Farrah who are doing this important work every day. And as she noted, this cannot happen soon enough. We are excited about where we are. We are excited about the progress we have made towards the realization of the vision for the community care campus. And now with VOA as a partner, we are all going to be working even harder every day to make this a reality as soon as we can. We don't have time to spare. You heard about Farrah's example just today. We need to help families like she mentioned as soon as possible with more support, more services, and more shelter. And our administration is committed to working with VOA, the Coalition for the Homeless, Goodwill, and Farrah's team, and every other organization around this city that wants to be part of the solution. Part of the solution on the community care campus and part of the solution elsewhere in this city so that we can work to end the plague of homelessness that is impacting far too many families, far too many people in our city. Thank you all very much, and we're happy to take a few questions from the media. Yes.
Can you talk about where the money is going to be coming from for some of these, especially the larger project like the 80 units of permanent affordable housing? And is it contingent on getting the $22.5 million from the state legislature?
Well, we certainly would love to have the $22.5 million from the state. And what is being referred to is part of our legislative agenda for the General Assembly, which begins in January. We are asking for certain one-time investments from the state in Louisville. And one of our top priorities is an ask for $22.5 million to support one-time development and construction at the community care campus. In addition to that, there are several other sources of funding available. There's funding available through the opioid settlement money that is going to support individuals who are addicted, many of whom are also homeless, many of whom fall into this category of families that are in either experiencing homelessness or at risk. There's philanthropic money that we plan to seek as well. The city will continue to have to invest. There's also some federal funding that we're going to pursue, and then also the organizations themselves that are part of that, VOA and others that are working to put together separate financing from public and private sources to help make this a reality. So there are going to be funds from all sorts of different places. Each part of the campus will have its own source of funding for the initial work that's needed to get it open, and then it will have an operating budget as well, much of which will be paid from third parties, whether it's for rent, whether it's Medicaid reimbursement, et cetera.
Isn't like a line item hammered out list of we're going to need X amount of money for this, X for this. It sounds like it's a bit more conceptual at this point.
Well, VOA, as part of their response, has provided budgets for some of the initial buildings on the project, and so we are working on the sources of funding for those budgets right now.
Speak about the timeline, when we can see this up and running.
Well, we'd like for it to be as soon as possible. So as I just mentioned, VOA has some initial plans for several of the buildings on the site, not the entire site. And so VOA already is working with a construction company on those plans. And as I mentioned, we're working on all the sources of the funding. So we are hoping that we'll see construction next year. Jennifer, I don't know if you want to provide.
That's right.
Okay.
I'll just say one more thing, Mayor. So we have about a 90-day process with our construction partner to do some master site planning. We actually had a meeting of our board of directors. My board chair, Dr. Kelly Dunn from the University of Louisville, is here today. She and the rest of our board heard a presentation from Miranda Construction that contemplates all of these various components on the campus. We're going to prioritize the family shelter to go first out of the gate. That obviously is the most urgent need facing our community. So they hope that in the next 90 days, if they come back and we meet with our Metro partners and everyone's agreeable to the proposal, that they'll begin breaking ground in the second quarter of the calendar year.
Just one more thing to add on that. This is very common with public projects. We are operating in the public realm. We're operating in an era of transparency, which is incredibly important to our administration, to our city. And so we want to keep everybody informed of the project. We have to go through specific public bidding processes to make decisions like we made that led us to today. And so this is very standard that we continue to move forward without every question answered, but knowing with the commitment that we have and the resources that are available local in the state, across the country, we will get this done. Yeah.
This could be for you or Jennifer, but Norton Healthcare had been a leader of this project for a while. I know you said that there are still current conversations about the medical respite facility. In what order would the medical respite facility be built, and how much can we promise, or is it a concrete plan that the medical respite facility will be a part of this?
Norton Healthcare does amazing, important work in our community. U of L Health, Family Health Centers, St. Vincent de Paul, Volunteers of America, so many other organizations are providing services right now that support individuals in need. Norton Healthcare is one of the entities that VOA and Louisville Metro government continues to have conversations with to see if there's the right fit for some of the things that they are looking to do to provide additional services, healthcare services in our community to individuals who are homeless. And so those conversations are ongoing with them, as well as other healthcare and other social service providers. So we're not to a point yet where we can make an announcement about that, but we are having conversations, and we are supportive of Norton. We're supportive of U of L Health. We're supportive of Family Health Services Center. We're supportive of all of the other healthcare and social service agencies that do this work. And if they're not doing it on community care campus, that's okay, because we need these services in many parts of our city, serving many people who are currently homeless or who are at risk of being homeless. And we're going to support that work, whether it's on the community care campus or elsewhere. In terms of medical respite, that is certainly a priority. We are having conversations with several healthcare facility organizations right now to try to make that work on this campus. We can't give you a definitive answer on that right now, but conversations are underway because that is a need of this community. We need a medical respite facility so that when individuals who are homeless are discharged from the hospital, they have a place to go to transition into some more supportive housing where they can eventually get back into permanent affordable housing, which is what Natalie talked about, which is the ultimate goal, the ultimate solution here to address our affordable housing crisis, to support individuals who are homeless. We simply need more affordable housing all across our city. That's the ultimate goal for all of these individuals. Any other questions? Did you want to add anything else to that, John? Okay. Last question.
Jennifer, could you talk about, I see on here, touchdown spaces for other organizations. What might that look like?
Well, that's yet to be determined. What we propose to the mayor and the Metro team is that we want to be a safe space of convening partners. So we're going to have ample touchdown space, as we articulated there, for other providers of services to come on campus, even if they don't have a permanent residence on the campus, to be able to provide, maybe it's health screenings. Dr. Dunn had a suggestion this morning at our board meeting about some additional ways that we could partner in the community. So we want to leave a lot of openness just to have some creative ideation together. None of this is set in stone today. This will be an iterative process, but we do want to make sure that this campus is welcoming and inclusive to many different sectors throughout the community.
Thank you all very much. We will continue to update you as progress is made. We are very excited about that and about this. As we mentioned, we have a lot of work to do. We have no time to waste. So we're going to get back to work. Thanks a lot.